Rheumatoid arthritis, RA, is a chronic autoimmune disease that primarily affects the joints. It is characterized by inflammation, pain, stiffness, and swelling in the joints, typically symmetrically affecting the same joints on both sides of the body. In rheumatoid arthritis, the immune system mistakenly attacks the body's own tissues, specifically the synovium, which is the lining of the joints. This immune response leads to chronic inflammation, which can eventually damage the cartilage, bone, and other structures within the joint. RA can affect various joints, including the hands, wrists, elbows, shoulders, knees, ankles, and feet. It can also affect other parts of the body, such as the skin, eyes, lungs, heart, and blood vessels. Seropositive refers to a specific type of RA characterized by the presence of certain antibodies in the blood. These antibodies are called rheumatoid factor, RF, and anticyclic citrullinated peptide, anti-CCP, antibodies. When a person with RA is tested, if the results show the presence of RF or anti-CCP antibodies in their blood, they are considered seropositive. These antibodies are produced by the immune system in response to the autoimmune process in RA. Seropositive RA is associated with more severe disease progression and a higher likelihood of joint damage and complications. It may also have different treatment responses compared to seronegative RA, which is a form of RA where these antibodies are not detected in the blood. It's worth noting that not all individuals with RA test positive for these antibodies. Approximately 70 to 80% of people with RA are seropositive, while the remaining 20 to 30% are seronegative. The presence or absence of these antibodies helps in diagnosing and categorizing different subtypes of rheumatoid arthritis. Seronegative rheumatoid arthritis, RA, is a subtype of RA characterized by the absence of certain antibodies, specifically rheumatoid factor, RF, and anticyclic citrullinated peptide, anti-CCP, antibodies, in the blood. In seronegative RA, individuals experience symptoms and joint inflammation similar to those with seropositive RA, but they do not have the detectable levels of RF or anti-CCP antibodies. Instead, other markers, such as elevated levels of inflammation markers like C-reactive protein, CRP, or erythrocyte sedimentation rate, ESR, may be present. Instead, other markers, such as elevated levels of inflammation markers like C-reactive protein, CRP, or erythrocyte sedimentation rate, ESR, may be present. Seronegative RA accounts for approximately 20 to 30% of all cases of rheumatoid arthritis. It tends to have a milder disease course and is associated with a lower risk of joint damage compared to seropositive RA. However, it's important to note that seronegative RA can still cause significant joint pain, stiffness, and disability. Rheumatoid arthritis, RA, can present with a variety of symptoms, which may vary in severity and can fluctuate over time. Here are some common symptoms associated with RA. Joint pain. Persistent pain in multiple joints is a hallmark symptom of RA. The pain is often characterized as aching, throbbing, or stiffness, and it may be worse in the morning or after periods of inactivity. Joint swelling and stiffness. Swelling and inflammation in the affected joints can lead to visible swelling, tenderness, and limited range of motion. Stiffness may be particularly pronounced after periods of rest or inactivity. Joint warmth and redness. The affected joints may feel warm to the touch and appear red or inflamed. Fatigue. Many people with RA experience a persistent feeling of tiredness, even after getting adequate rest. Fatigue can significantly impact daily activities and overall quality of life. Morning stiffness. People with RA often experience prolonged stiffness and decreased mobility in the morning or after long periods of inactivity. This stiffness can last for several hours. Systemic symptoms. RA can affect the entire body, leading to symptoms beyond the joints. These may include low-grade fever, loss of appetite, weight loss, and general malaise. Joint deformities. Over time, RA can cause joint damage and deformities, such as joint erosion, joint misalignment, and the formation of nodules under the skin. Rheumatoid nodules. Firm lumps or nodules may develop under the skin, commonly on the elbows, fingers, or other pressure points. Reduced mobility. As the disease progresses, joint damage can lead to decreased mobility and difficulties in performing everyday tasks. The treatment of rheumatoid arthritis, RA, aims to reduce inflammation, relieve pain, improve joint function, and prevent or minimize joint damage. The treatment approach for RA often involves a combination of medication, lifestyle modifications, and supportive therapies. Here are some commonly used treatment options. Medications. Nonsteroidal anti-inflammatory drugs, NSAIDs. These medications help reduce pain and inflammation. Disease-modifying antirheumatic drugs, MARDs, such as methotrexate, sulfasalazine, and hydroxychloroquine, are used to slow down the progression of RA, reduce inflammation, and protect the joints. Biologic MARDs. These newer medications, such as tumor necrosis factor, TNF, inhibitors, interleukin-6, IL-6, inhibitors, and Janus kinase, JAK, inhibitors, target specific immune system components to reduce inflammation and joint damage. Corticosteroids. These medications provide fast-acting relief from inflammation and pain. They are typically used for short periods and at low doses due to potential side effects. Physical therapy and exercise. Physical therapy. A physical therapist can provide exercises and techniques to improve joint flexibility, strengthen muscles, and reduce pain. Range of motion exercises. These exercises help maintain joint mobility and prevent stiffness. Strengthening exercises. These exercises target specific muscle groups to provide support to the joints. Aerobic exercises. Low-impact activities like walking, swimming, or cycling can help improve cardiovascular health and overall well-being. Lifestyle modifications. Rest and joint protection. Balancing rest and activity can help manage symptoms and prevent excessive joint stress. Assistive devices. The use of assistive devices like braces, splints, or canes can support and protect the joints, reducing pain and improving function. Weight management. Maintaining a healthy weight can alleviate stress on the joints and improve overall well-being. Stress management. Stress can exacerbate RA symptoms, so techniques like relaxation exercises, meditation, or counseling can be helpful.